Hello, dear friends. I'm back once again. So, as I told, that science-backed information should be used to deal with corona. So, in that earlier small talk, I just have put something and how do you deal with it. Same thing is, there have been many studies that has been uh, done, and all those studies have been focusing on helping what needs to be done. So, and every time we seek treatments, we understand one thing, that our health experts, they don't always tell us about every aspects because of shortage of time, because of the way uh, the setup is made for COVID-19 and all those things. Now, how do we deal with the issues? So imagine that you have been diagnosed with COVID-19 and you have symptoms. You have throat irritation, you have nasal irritation, you have cold, flu like symptoms, you have slight temperature, you have nasal discharge, you may even have some perversion of smell, you may not, you might have lost the smell. So the symptoms have started and you have been diagnosed with COVID-19. Now, what do we do? The things. The first thing you should always understand is you need to stay well hydrated. When I say well hydrated, I mean that you need to increase the intake of fluids, and that fluid should be in the form of coconut water, juices, all kind of juices, carrot juice, beetroot juice, palak juice, or karas, all kind of juices. We need to increase. If you stay well hydrated, your body will be able to discard the accumulated exudates from the infection. So that's why you need to stay well hydrated. First thing. Second thing is you need to stay mobile. Just because you are positive with COVID-19, you should not lie down, especially in the supine position. You should see that you're mobile, you're walking, you're breathing, you're keeping yourself well optimistic, with an optimistic outlook. It's very important. And then you need to add certain things that the doctor suggests you to take. You need not take antibiotics right from the day one. You need to wait for 72 hours. For 72 hours, you keep yourself well hydrated. And that's where 80 to 85% people, they become well. So the symptoms, they don't go into chest congestion, they don't go into chronic cough, they don't go into pneumonia. Only after the third day, that is when you'll need the real medical help. So you seek out, reach out to your doctor, ask him for the best treatment that is possible. And not the best treatment, also the least harmful treatment. And once he has asked you to do so, remember to add, remember to add, remember to add curcumin. Curcumin with bioperin. Remember to add that, because that will take care of so many things. It will help you deal with the virus. It will help you with the exudates of inflammation. It will help you with the phlegm that is being collected because of the infection. So curcumin here acts as expectorant, it acts as immunomodulator, and it definitely acts as antibiotic also. It is highly antiseptic. We know that from our practices. And once you add this along with your treatment, the chances that you are going to go into a cytokine storm are far less, because there are many studies which is posted in my silent video earlier, and in that I have posted out the links whereby curcumin has really helped COVID-19 patients. So you need to use it in that form. And the second part is, can we use CBD? Yes, definitely we can use CBD. Again, in the silent video, add up, I've put up the links that are available where there are studies done with CBD and THC who have helped us in the respiratory distress syndrome as well as, healing the COVID-19 patients. And what else can we do? The other things that we do is stay mobile. Please stay mobile. Don't lie down on your back with your mobile in the hands. That will, you know, collect the phlegm inside the lungs. You can lie down supine. That is very good. Lie down on your prone position. Sorry, you can lie on your belly with a pillow under your belly so that the secretions are, and also the frog position. Like when we used to study, we used to kneel down, frog position. That is also very good because the phlegm will keep coming out, and as much phlegm keeps coming out, you need to replace it with juices, whether it is coconut water, whether it is lime water, any kind of juices, all kind of juices. Please avoid refrigerated things. Why? Because refrigerated things are all phlegmatic. They will increase the phlegm in the chest and the respiratory tract. So if those are increased, then phlegm is increased. The chances of you getting into pneumonic condition will be very high. And people who have comorbid condition, we need to be careful. People with diabetes, people with heart issues, because they have underlying insulin resistance. Insulin resistance mean weak immune system. System is already weak. Still, you can deal this with curcumin and added medical cannabis, because that can really give the needed zest for the person, because medical cannabis will give you the needed high when you're stressed and tense, and when the doctor has already told you that the CRP levels have been increasing, the CRP levels have been rising. So the CRP levels can be tested. But CRP levels under 10 are most favorable, and you need to keep it in that way. And curcumin will definitely help you do that. Now, what are the other preparations of curcumin that are available with us? So you have curcumin along with bioperin, you have haridra, you have haridra khan, you have plain turmeric formula capsules. All of these are fine, and any dose between 200 milligrams to 600 milligrams is good enough to keep your immune system in prime condition. Please do consult your doctor if you want to add CBD to your COVID convalescence period, because that will really help you come out of it. Post COVID arthralgia, post COVID weakness, uh, post vaccination, COVID vaccination arthralgia, prolonged fever due to COVID vaccinations, all this can be taken care of with medical cannabis, because NSAIDs are contraindicated post COVID vaccination. So these are the things you can do. And please don't line up for vaccination, because vaccination is prevention. It's not for cure of the pandemic. And you need to educate yourself well with the scientific facts of how to deal with COVID-19. So my 25 cents will be that stay well ventilated, stay well hydrated, stay in optimistic psychological outcomes. Watch comedy shows, watch light-hearted things, and stay well ventilated. And along with that, do add turmeric, curcumin in any form. And if you are in the belt where cannabis is readily available, do add cannabis or bhang in your day-to-day consumption. And you'll see that all these things will ease out much faster. So please take care of yourself, stay well hydrated and well ventilated and optimistic. My prayers are with you. Thank you. for joining and listening to me. Thank you.